Making on these COVID-19 boosters. It can get confusing about who's eligible to receive one. Evan Kozlov breaks down who gets a third dose.
A major announcement from the CDC. Booster shots are now approved for millions of Americans. So let's verify some of the details so that we can be sure that we're sticking to the facts. Here are our sources: the CDC, the FDA, William Schaffner from Vanderbilt University, and Amesh Adalja from Johns Hopkins. Let's start by talking about who's eligible. We can verify that according to the CDC, those over 65 should now get a third dose of the Pfizer shot, so long as it's been 6 months since they first got vaccinated. Same goes for those receiving long-term care and those 50 to 64 who have an underlying condition such as diabetes, obesity, or heart disease. As for those 18 to 49, the CDC says that they may now get the booster if they have an underlying condition, but they're recommended to talk to their doctor first.
This is more commonly referred to in medical language as shared decision-making, where you speak to your physician and say, should I get this booster? Should I not get this booster?
Next, let's verify if you could get a booster if you work or live in a place where the risk for COVID is high, a so-called occupational or institutional environment. For example, healthcare workers or teachers. Initially, the answer was no. The CDC's advisory committee voted against recommending boosters for these people, but that was reversed by CDC Director Rochelle Walensky.
Anyone who works in an occupational or is housed in an institutional setting where there's the potential for high transmission, they also would be eligible for a booster.
So verified, yes, you could get a booster after 6 months if you work in one of those environments. Lastly, let's verify. What does this mean for those of us who got Moderna or Johnson & Johnson? Are you recommended to get a booster shot at this point? Our experts say that the answer is no. That's because no Moderna or J&J boosters have been approved, and it's not recommended to mix and match.
The official recommendation is not yet. Please be patient.
With your Verify, I'm Evan Kozlov.